Hey everyone, this is Callie AleschandGlenn, and we will be presenting today on Munchausen syndrome by proxy. So this is just a breakdown of what we're going to be going over. First, we'll do an introduction. We'll go over the different types of Munchausen, diagnostic criteria, signs and symptoms, treatment, a SOAP note, and then lastly, Munchausen in the media. So Munchausen syndrome was first used in 1951 by Richard Asher, and he used it to describe individuals who sought out unnecessary medical treatment by making up various signs and symptoms. And then in 1977, we first see Munchausen by proxy used to describe children whose caregivers were making up information to receive unnecessary medical care. Nowadays, we will sometimes see it termed as factitious disorder imposed on self or other. And this syndrome gets its name from a fictional character, Baron Munchausen, who is based off of a real-life person whose name I won't attempt to pronounce. But this person in real life was a German war hero, and he was known to exaggerate some war stories.
So there's different types of Munchausen by proxy. The first one is going to be chronic Munchausen by proxy. This is characterized by the constant pursuit of attention through harming another individual. There's also episodic Munchausen by proxy, and this is characterized by intervals in which the sufferer experiences symptoms for Munchausen, followed by a hiatus in which he or she can conduct a normal life. Next will be extreme cases. This is when the caregivers can induce severe symptoms in the child, but they appear cooperative, compassionate, and concerned in the presence of a physician. This is often called active inducers. Last, it'll be mild cases. This is when the caregivers often forge medical histories and lie about the child being sick rather than them actually causing sickness on the child. The caregivers often do this for emotional gratification that they feel from receiving attention from the doctor. They're often described as doctor addicts.
So this is the actual diagnostic criteria from the American Psychiatric Association. The first point says that there will be psychological and physical signs and symptoms or induction, lesion, or disease that are faked in association with identified fraud. The individual will present the victim as ill, impaired, or injured. There will be fraudulent behavior evident even with the absence of obvious external rewards. The individual's behavior is no longer well explained by a disorder such as delirium or other psychotic conditions. And as Fielding just said, this could be a single episode or it could present in recurrent episodes.
So some signs and symptoms. The symptoms involve mimicking or producing illness or injury or exaggerating symptoms of impairment to deceive others. People with this disorder often go to great lengths to hide their deception, so it's difficult to realize that their symptoms are actually part of a serious mental health disorder. Patients continue with the deception even without receiving any visible benefit or reward or when faced with objective evidence that doesn't support their claims. So they'll continue even when they're approached by doctors or social worker, anybody like that. The caregivers that present with this disorder often have extensive knowledge of medical terms and diseases. They may also present with vague or inconsistent symptoms, and they are typically reluctant to allow doctors to talk to family or friends or to other medical health care professionals. So treatment is difficult and not structured, but they do recommend psychotherapy for patients that present with Munchausen. So in an article, Feldman says virtually all caregivers who have this have personality disorders that lead them to behave in odd or even destructive ways, especially when they feel under stress. In most cases of Munchausen, the caregivers are fully aware of their behavior but reluctant to openly acknowledge it. It is important that the caregivers with Munchausen undergo extensive psychotherapy, but targeted treatment for Munchausen's are very limited. And then Schreier and Lebo in another article said that the therapist's task in psychotherapy is described as uncovering and interpreting these fantasies and behaviors to the patient during psychotherapy. So next we have our SOAP note. This is right here. So first we're going to start with subjective. So we're going to privately ask the patient if they've been abused, and if so, for how long. We may not be able to ask this question direct because they're going to deny it, and then they're going to know what we're trying to get at. But we can go about this in asking questions like, how do you feel? If the patient is reportedly paralyzed, you can ask if they've ever walked. You can ask if they feel safe at home. If the patient is reportedly fed through G-tube, then you can ask if they've eaten by mouth, or do they eat by mouth, or can they eat by mouth. And if the patient is bald, you can ask if their hair fell out from medication. Oftentimes, the parent may shave the patient's head and say, it's going to fall out anyway, so let's go ahead and shave it. So this question may give us the answer if it was actually done through medication or if the parents just shaved it. So how often does the patient present to the P&P or the emergency department? These patients often have multiple primary care visits or ED visits, which may indicate soliciting unnecessary medical care. How many different illnesses has the patient been diagnosed with over the lifetime, and when were the initial diagnoses made? It's important to have a list of the various diagnoses and when the initial diagnoses were made and by whom. Then you can look back at the patient's history to help confirm or deny Munchausen's. How many different specialists does the patient see? Multiple specialists may indicate that the caregiver is doctor shopping, which is seeing multiple providers in order to eventually receive a certain diagnosis, prescription, or medical treatment or procedure. And then what is the victim doing to stop the abuse? Is the victim aware that this is abuse, and if so, are they taking measures to stop it themselves or with the help of other family or friends? And then as far as objective, is the child actively being abused at this time? So the child needs to be interviewed separately from the caregiver that is suspected of being the abuser in order to get a full history and unbiased answer. And then you're going to want to look at how the child appears. Most of the time, these children will appear ill because their head's going to be shaved. They're going to be in a wheelchair. They're going to have different tubes. However, diagnostic tests are going to indicate if the patient is ill or not. You're going to want to examine the child from head to toe, focusing specifically on each system. So a detailed exam may indicate which systems have full or limited function, but the caregiver may report otherwise. So if reportedly the mom says they can't use their legs, but it looks like they have maybe limited function, then you know something's going on. For example, if they have muscles in their legs, but they're reportedly paralyzed, you know that they're not paralyzed. You also need to look when you're examining the patient from head to toe if there are different stages of bruising present, which may indicate physical abuse. It's also important to get blood tests on these patients. This can help rule out cancer, muscle disease, bleeding disorders, liver functions, dehydration, etc. So you'll want to do a CBC, a CNP, lactic acid. Those are kind of baseline. There's definitely more that could be done though. But you're going to want to do these blood tests to see if there actually is something going on underlying, or if the suspicion for Munchausen is appropriate. Lastly, you're going to want to do a complete skeletal survey. This can show any broken bones that may be present, which will represent physical abuse. It can also show healing fractures, which again represents physical abuse. And then it may also represent bone erosion, which can indicate many years of malnutrition.
Under assessment, we have Munchausen by proxy and then also differential diagnosis. Munchausen may be suspected if the patient has multiple medical complaints or diagnoses that are not able to be confirmed or denied. And as we've said before, there may be multiple visits to doctors' offices and emergency rooms. As far as the differential goes, there's a ton of different things that could be possible, mainly some rare and uncommon medical disorders or syndromes. If these are suspected, you need to confirm them with medical testing, maybe some genetics as well. For plan, we would first want to identify Munchausen by proxy. We would want to interview the caregiver and the patient separately to get a full history. And we also might consider use of a video monitoring room if it's available. This allows us to see if the caregiver is tampering with anything in any sort of way. Once this is confirmed, we would want to ensure that the patient is medically stable and safe, and place a phone call to DFACS and also a social worker. To confirm the medical stability, we'd want to, again, complete a full head to toe and do some lab results. And once DFACS and social work are involved, they will either remove the child from the home or come up with a proper safety plan. The patient, depending on their age, may require some psychiatric involvement. Some therapies and counseling may be indicated for their mental health. And lastly, the patient might need to be weaned off of any drugs or remove any necessary medical devices or treatment. Some of the pharmacological agents, you'll need to monitor the patient to make sure they're not having any adverse reactions. And removing unnecessary medical implants or devices such as G-tubes or CVLs should also be done, and we should monitor the patient for safety during these procedures.
So lastly, we have a little Munchausen in the media. So there is actually a documentary, an HBO documentary called Mommy, Dead, and Dearest. It's a story about Gypsy Rose and her mother, Dee Dee. So Gypsy is the victim in this situation, and her mother is the abuser. So this went on for 20-something years. Gypsy was said that she had leukemia, said that she had epilepsy, was wheelchair-bound, many different cases. And there's actually a psychiatrist that talks about Munchausen's that I thought was well done. So I'm going to let you listen to it real fast.
Gypsy Rose Blanchard was as consistently and viciously subjected to, in my opinion, Munchausen by proxy as anyone I've come across. Munchausen by proxy involves a caregiver who either feigns or actually induces illness in her children, and her goal is some kind of emotional gratification, looking for sympathy, attention, care, concern that she feels unable to get in any other way. It is a form of child abuse, first and foremost.
The earliest surgery that I can remember probably
All right, and this is just our reference page. I hope you all enjoyed this, and let us know if you have any questions.